we'll actually be looking at some parameters. So these parameters are basically related to what? Bone metabolism. Alright, how minerals are deposited in the bone, okay, which will now make it to have strong bones, or to now make it to have what? Weak bones. So we're looking at the bone formation rate. Okay, we'll look at the bone formation rate, we'll look at the mineralization lag time, we'll also look at the what? Dynamic histomorphometry. Okay, so for the first one, which is what? First of all, you should know that all those parameters, they are used in bone histomorphometry, okay, which is a microscopic study of what? Bone tissue dynamics. You are trying to see how, you know, things are going on in a bone. Do you understand? And of course, this forms the basis of you studying about those fractures, why somebody has a weak bone, and all of that. So bone formation rate on the side now is a rate at which new bone tissue is formed. Is calculated from the amount of new bone surface covered by osteoblast and the thickness of a new bone laid down. So it's often expressed as what? Volume of bone formed per unit of bone surface per time. So clinical use can now be used in all those metabolic disease, all those osteoporosis, osteomalacia, renal osteodystrophy. Do you understand? And it can also use to access how, if you are treating a patient that has a weak bone, you now want to access how the patient is basically what? Recovering. Okay, so for the next parameter we should be looking at, we'll look at the mineralization lag time. So it's just a time interval between the deposition of osteoid, that's unmineralized bone matrix, and its subsequent mineralization. So clinical use, it indicates what? Defective mineralization, all those rickets, osteomalacia. Alright, but if you have a normal mineralization lag time, it suggests that there's an intact mineralization, okay, despite possible changes in bone turnover. Now for the last parameter, we'll look at the dynamic histomorphometry. So you can see a lot of colors on the image I have here. Okay, a lot of colors. Now I have those colors because what? It uses a fluorescent label, so you can label using tetracycline or calcine to measure dynamic processes in bone, such as how bone is formed, how bone is mineralized. You know, so it makes use of what? The bone formation rate, mineral apposition rate, also the mineralization lag time. Okay, so method is that the patient receives 2 doses of fluorescent markers at known intervals. Then a bone biopsy is done. So your bone will now be examined under the microscope. So under the microscope, they get to see how, you know, bone formation is going on in your body. All right. So distance between fluorescent lines indicates the rate of mineral deposition in that person's body. So for these 3 parameters as related